everyone. It's Dr. Brooke Kolisiak, Legacy Physical Therapy, coming back into you again on Wednesday at noon. So thank you everyone for turning in. Hope everyone's having a great day. Today I wanted to talk to you about 3 simple, easy exercises that you can do to start reactivating your core muscles in that early postpartum days. So a lot of women are very concerned about making sure that their muscles that have gotten stretched out and potentially overworked during pregnancy come back the way that they want them to. And so there are things that you can be doing very early on in the postpartum recovery time to start to make those muscles kind of get back into a place where they feel like they are working together a little bit better. And the beauty of these exercises is that they are very simple to fit in. I'm going to show you 3 of them, or talk to you about 3 of them, I guess, today. So they are all about the core muscles, which involve the diaphragm on the top, the abdominals on the front, and the pelvic floor on the bottom. And so we are going to be looking at how we can easily kind of activate those guys to work together to create some nice support for that postpartum belly as it's healing. And that's so as in anything, it's probably a good idea to potentially consult your physician before starting up with this, but these are very simple and easy to do. They should not be painful at all. If you are experiencing any pain when doing them, please stop. But you can do this as early as day 1 after you deliver. Just do it in kind of a comfortable range that's not causing pain. And I'll go through a little bit after I describe the exercises as to how they are helpful for the healing process in general for you. So the first one is simply doing nice, big, deep breathing. Okay, so sitting in a relaxed position, maybe you're in like a recliner, you're in a comfortable chair, sitting on your couch, but just taking nice, big, slow breaths in and out, where as you inhale, big and slow, you're letting your abdominals expand and your belly kind of fill up with air. Everything's kind of expanding or opening out. I think of it as like opening up like an umbrella, and maybe doing that on like a 4 count. And then as you exhale on a nice slow 4 or 5 count, everything kind of comes back in together. The beauty of doing deep breathing is that we get movement of the diaphragm, the abdominals, and the pelvic floor all together. So as we inhale, the diaphragm comes down, the abdominals expand out, and the pelvic floor comes down a little bit to accept the load from that increased air pressure. And then as we exhale, the pelvic floor rebounds back up a little bit, the abdominals come back in a little bit, and the diaphragm goes back up. So without you really even trying to work the abdominals, you end up getting movement through the abdominal and the pelvic floor muscles and get them all working together in a nice controlled fashion. So what I recommend is maybe 2 or 3 times a day, just sitting comfortably or laying down. So that's another great position to do it in, doing 5 to 10 deep breaths. This is a great one to combine while you're breastfeeding, because of doing that a lot in those early postpartum days or when you're just feeding your baby. So it's a great time to be able to kind of slow things down and take those nice deep breaths to get movement through the abdominal wall and the pelvic floor and the diaphragm all together. So the next 2 exercises pretty much play off of the deep breathing, okay? And what they are doing a little bit of a deeper abdominal muscle engagement is the first one. And that's so with this one, what I want you to try and do is you're just going to take a nice easy breath in. And then as you exhale, I want you to think about trying to gently draw your belly away from your pants or away from your underwear. It's almost like your pants are a little too tight and you're just trying to draw your belly in a little bit. You should be doing it on an exhale. You shouldn't be holding your breath. We're not trying to squeeze our belly in as tight as we possibly can. we're just doing a gentle activation. Remember, these muscles are recovering from being stretched out for the last 9 months. They are going to need some help to learn how to kind of contract together and work. So gentle activation of these muscles is a great way to get that to happen. So you can do it, like I said, on an exhale, and then get those muscles to pull in like you're pulling your belly away from your pants a little bit, just gently. Hold it for a few seconds. You should be able to talk while you're holding it, so talk with your baby or anyone else in the room, and hold it for maybe 3 to 5 seconds, and then let it relax. Again, doing 5 to 10 of those at a time, a couple different times a day, is a really nice, easy way to start reactivating the abdominal muscles, to get them turned back on and doing a little bit more from you and help them recover from that kind of stretched out position that they were in during pregnancy. So that's the second exercise. Third exercise is working the same concept, but with our pelvic floor muscles. Okay, so we're gonna take a gentle inhale, we're gonna exhale, and as we exhale, we wanna think about lifting our pelvic floor up. If we're in sitting position, you wanna think about lifting your vagina up off the chair a little bit. If you're laying down, think about trying to pull the vagina up and into the body. Again, it should be very gentle. You shouldn't feel any pain with this, but you're just trying to get a little bit of that kind of draw up and in and puckering motion that the pelvic floor muscles do. Okay, these are the muscles that we use to stop the flow of urine, so you can potentially use that visual. Again, just like with the abdominal muscle contraction, it is not about doing a big, hard, maximal contractions. You just delivered a baby. We're just trying to reactivate these muscles and get them going. So just like with the abdominal ones, a little inhale, then exhale and tighten, and hold for, again, maybe about 3 to 5 seconds if you can, and then let it relax. Doing 5, maybe 10 repetitions a couple times a day. Again, when you're feeding the baby is a great time to get this in. Is a good way to start activating the pelvic floor muscles. Okay, so there you have it. We just went through 3 different ways to start reactivating the core muscles. Just as a reminder, a refresh with them. First one is just taking 5 to 10 big, slow, deep breaths in and out. Second one is trying to activate the deep abdominal muscles by drawing the belly inward as we exhale. And then the third one is activating the pelvic floor muscles by trying to draw the vagina up and in as we exhale. Okay, all of these should be done gently. None of them should be painful, especially in those early postpartum days. You might not be able to do many repetitions, and that's okay. I like to equate this early activation of the muscles to thinking about it like if we sprained an ankle. So when you sprain an ankle, it gets all swollen and painful and irritated, and you may not want to move it much, but the first thing that they're going to tell you to do is to gently move the ankle, kind of bend and straighten it in a range that you can tolerate. So that gentle movement helps to get the blood flowing to the area, which helps the tissues to heal, helps to get swelling out of the area. And that same concept can be applied to the deep breathing, the deep abdominal activation, and the pelvic floor muscle activation that you do in the early postpartum period. Ruth, great question about precautions or delays as a result of a C-section. No specific ones. You still can do this in the early postpartum days. You're just probably going to feel like you want to do it much more gently. And just like I said, I don't want anyone doing it maximally contracting, but just easy activation to try and get those muscles going. Not anything so much so that you feel like you're really pulling or tensioning on the scar too much. So again, if it's painful, then lay off of it for a couple days and then kind of restart. But it's just making it kind of gently work, get the blood flowing, help get swelling out of the area, and help get those muscles to reactivate. Well, there you have it. I hope this was helpful as far as what you can do in those early postpartum days to get the core muscles reactivated and going again. If you have questions, drop them in the comments. I'm happy to answer them. And if you have suggestions for any future topics that you want me to talk about, again, drop them in the comments and I will happily discuss them with you next time. So see you guys next Wednesday. Take care.